Hello, everyone. Welcome to your weekly motivational moments with Eric Vickery, president of coaching at All Star Dental Academy. With me is my dear friend and fellow coach, Shyanne. How are you, Shyanne?
I am doing wonderful. Thanks for having me, Eric.
We're coming back with another session. These are coaching corner, coaching connection, just weekly talks. And I think these are good for us to hear what you're working with your clients on. So, what do you have for us in the second week?
So, the second week, I wanted to touch a little bit on that condition that we were talking about earlier with the 95-5 case acceptance formula. But
Yes.
now we're going to place it into hygiene. So, how are we creating value and urgency when it comes to those hygiene visits? I'm seeing
Yes.
with a lot of my clients right now those holes in hygiene. And the thought here is that patients are seeing it as just a cleaning. So, how are
Hmm.
we, again, creating that value and urgency where it's more than just a cleaning? And again, I'll go back to that condition. This plays a role in preventing cancellations. Eric, you know this. You talk about this all the time with your clients as well. But what we really want to do is connect a condition. So something like bleeding in the gums, the decay, whatever it may be, right? That
Hmm.
cracked tooth to the time apart that they are from us,
Hmm.
increasing value and urgency.
And it could also be that they're healthy and you want to help maintain that health, right? That I hear that
Exactly.
all the time from hygienists.
Smile.
Yeah.
Mhm.
Maintaining health could be the 95. So what just reason for return, what does that sound like? You're the hygienist, I'm your patient. How does that sound?
Yeah, and connecting the length of time that they're apart from us and that condition. So
Hmm.
if I'm the hygienist, then when I am scheduling that patient, I'm bringing up that concern. Hey,
Hmm.
Betty, I'm concerned with bleeding in the gums, and therefore my recommendation is to see you no more than 6 months from today. So I'm setting that ceiling,
Mm.
connecting that condition. There's a reason for them to come back. It is not just a cleaning. We're not just scheduling their next visit. We're scheduling for a reason. And we can use that if a cancellation call comes in, right? We should be notating this in the patient's chart that we've had that conversation. That reason for return is written down. So, admin team, when you get that phone call, right? When you get that phone call, that call comes in, patient says, I'm going to go ahead and reschedule my cleaning. First thing we say is, oh, not okay. And then we're placing them on hold. We're looking for two things. Have they done this to us before? And what was their reason to return?
Yeah.
And then that conversation sounds like we're picking back up the phone. We're saying, hey, Betty, now that I pulled up your chart, I'm seeing here that the last time you're in, our hygienist noticed some bleeding in the gums, and she's concerned.
Yeah.
The reason I bring this up is we don't have another availability for 4 weeks, and
Three
so on.
months. Whatever.
Yes.
And
Yep.
then are you sure there's any way you can keep this appointment today? Because she's going to be so concerned. And sometimes they can, sometimes they can't. But even if you put it out, you planted that seed in their mind of concern for their health, not a policy,
Exactly.
right? Okay.
Exactly. Yes.
I also, you're talking about butts and seats right now this time of year, finishing the year strong. And I also hear in this conversation is the overdue hygiene piece of this. You're calling patients who are not on the schedule, who are overdue, and you're also using a reason for return. Is that right?
Mhm.
How does that sound?
Yep, we teach the message one, conversation one, right? So
Yeah.
the message that we leave is doctor's concerned, can you please give me a call? We're creating that
Yeah.
intrigue, please give us a call. They're not interested in helping us fill our schedule.
Hmm.
And then the patient calls back. We're saying, hey, Betty, you know, we haven't seen you since X date, right?
Hmm.
And then the reason I bring this up is because last time we were in, we were concerned
That's it.
about the condition.
Yeah. Last time you were in, hygienist noted maintaining health, inflammation, whatever it is. And I know you're concerned about that. Would it make sense to get you an appointment scheduled for it? Love it. So good. All of this connects. It prevents cancellations. It helps you stop cancellations. It helps you recover patients getting in butts in seats. So reason for return. I love it, Cheyenne. Thank you so much for bringing your knowledge to us. This is great. It's like, why don't you just coach them all? This is awesome.
Thanks for
Awesome.
having me, Eric.
I love it. Have a great week, everyone.